Please, sir, what is hepatitis?
Hepatitis is inflammation of the liver following infection or non-infection agents. The liver is a very vital organ in our body. It is responsible for a wide range of activities that makes life easy for the system. It is involved in the metabolism of protein, that is, it breaks down protein and also builds it up. So it helps in the production of clotting factors that is responsible for putting clots where there is bleeding so that the bleeding can be minimized. It also helps in the activation of some enzymes and also plays some excretory function as well as secretory function. Immunoglobulins, that means some big soldiers inside our body that is responsible for launching an attack against infection. The liver also helps in producing it. So when that vital organ becomes inflamed, it is called hepatitis. All right. What are the causes? The causes of hepatitis vary. It could follow infection, like I said earlier. It could even be because of the body's immunity that is mounted against it. We call it autoimmune hepatitis. It can also follow exposure to some chemicals. So you call it chemical hepatitis. It can even follow ingestion of some sets of drugs. Some drugs can also cause inflammation of the liver, which is hepatitis. And then some viruses like hepatitis A, hepatitis B, those ones follow viral infection. So those are the spectrum of causes of hepatitis. Once that happens, once there is an infection that is seated in the liver, it sets up a cascade of inflammation. And when there is inflammation which is not controlled over a long period of time, the liver becomes damaged. And once the liver is damaged, you have seen earlier that I've spoken about the functions of the liver. These functions become compromised. And once the functions become compromised, the person's immunity and other functions also become compromised. Such a person stands a risk of developing several consequences which may even lead to death. So how do we take care of our liver? There are various ways to prevent liver problems. Number one is to avoid alcohol. Alcohol does a lot of damage to the liver. Avoid drug abuse, because there are some drugs we take that go to the liver to go and damage it. We encourage people to take plenty of water, do a lot of exercise to burn out fat, because if we accumulate a lot of fat, fatty liver is also another cause of hepatitis. So we should engage in exercise, avoid sharing of needles, because when someone who has a needle prick following use of needle that has been used by someone who has hepatitis, the person stands a risk of also catching hepatitis, and hepatitis was a chronic cause and causes a lot of damage. Another one is to avoid taking unscreened blood transfusion. Before blood is transfused, we have to route it through a series of screening to be sure such a blood is fit for transfusion. These are many more are the measures we take to prevent hepatitis. Please stay safe. Thank you.